This is the Psychedelic Medicine Podcast.
Hello and welcome to the next episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and this week we're starting something a little bit new. I wanted to do a series of what I'm calling psychedelic adjuncts, which are different types of modalities that I think have been shown, at least for myself and others that I know, and sometimes in the research, to be helpful in either preparation or integration of psychedelics. And we are starting today with somatic therapy with Dr. Jenna Valentine. Dr. Jenna Valentine is a doctor of Chinese medicine who incorporates both functional medicine and somatic experiencing within her practice to help achieve optimal wellness. Now, I am super excited about this episode. I've known Jenna a long time, but if you have not heard of somatic therapy or somatic experiencing, if you have met me, you know I talk about it nonstop, and so many people come to me and say, "What is that?" And so I'm very excited to finally put out an episode where we get to talk about it. Now, before we get to Jenna, just a reminder that the Psychedelic Medicine Podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one last reminder, if you are a clinician or you know a clinician who would like to learn more about psychedelic medicine and how it may be beneficial for their patients, especially because coming into August 2024, we have an answer from the FDA as to whether or not they will be approving MDMA-assisted psychotherapy. So this is coming. If you'd like to learn more about MDMA and the other psychedelics and how they can be used in your clinical practice, or maybe you can refer patients to them, please visit the Psychedelic Medicine Association. It is our mission to educate clinicians of all types on psychedelic medicines, whether you just want to refer patients to them or perhaps maybe in the future want to learn enough and perhaps incorporate them into your own practice. We've got you covered. So please check us out at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Jenna.
Thank you so much for having me on. I'm really excited to be here.
I've waited for this conversation. I've always wanted to have it, and I'm so glad we're finally having it. I just have to mention that I believe it was a picnic where I met you, and it happened to be at this same picnic. I was speaking with somebody else, and she had done extensive, I think mostly like ayahuasca work and all these things, and I was just kind of asking her questions. I was still newer to the field at the time, and she just kept saying, the one thing that I find the most effective after all of these is somatic therapy. And I was in the position where I said, what is that? And I don't really understand what it is. But to me, it sounded like it made sense because even in different ayahuasca ceremonies, I would feel like my brain is getting a message and my nervous system never quite got that same message. Like I could cognitively know, like say, not to be anxious about something or, um, how to feel more connected to everybody. But my nervous system still seemed to hang on to the anxieties or the disconnected feeling. And so just the sound of something like, oh, you're going to work the therapy into my body where the nervous system lives. And so I was very excited about it. And so it's just a coincidence and a beautiful one that I met you at that same time. And you were highly recommended to me as, oh man, I will not name by whom, but she said, I go to Jenna for my somatic therapy. It is otherworldly. I can't even describe what she does, but I leave there transformed. And so I'm very excited to have you on. Can you talk a little bit about let's start with what somatic therapy is and some of the different forms of it?
First of all, thank you so much for all those words. I feel so good. Um, I think you're touching on so many things in what you just said. And one of them is the importance of integrating these big psychedelic experiences. And somatic therapy there's many different definitions of it, but the one that I love the most is guiding yourself back to your body as your primary resource. So in our westernized culture, we are so brain focused. And don't get me wrong, I love my brain. I love everyone's brain. It's super important. But we tend to think instead of feel so often. And so when our culture meets the culture of psychedelics, we approach it from a brain place because that's what we know the most. We've kind of had this amazing somatic experience as young children. We unlearn a lot of that. We learn a bunch of more cognitive skills through regular school and just kind of the way our world is. And we forget about this somatic piece. So when we enter into this world of psychedelics, we try to understand it with just our brain, which is such a small part of our overall body. And I think that's where the miss is that we walk away, we try to find words to describe these otherworldly and and these experiences that really words are not sufficient for. And we miss the opportunity to actually integrate them into our entire body. Like our brains are not just, the thing dragging our bodies around. They're part of a larger body, and there's so much wisdom from the neck down. And somatic work, somatic experiencing, Hakomi, somatic therapy, there's lots of different terms for it. It's essentially saying like, hey, we're missing out on a huge part of this benefit if we only try to understand it with our brain. So that's how I understand it. There's different practices for how to get there. And I have my favorites, but everyone has what's going to work best for them.
So when I started looking into somatic therapy, I have to admit that I felt like I was always going to fail it because I had met with a few practitioners and I just couldn't, like you said, get out of the brain. And I, how are you going to tell me that like, oh, we're going to put the brain aside and ask the body? And I'm like, just to me, just really, it took a second to understand that paradigm shift. And even now, as I work with my somatic therapist, and very often I'll think like, no, this thing is going to have to be dealt with by the brain. And she will say, no, I think we need to go in and ask the body. And she's always right. And so I love that you brought that up because I think so many people who are, like you said, if you're psychedelic interested, very often we're looking at, oh, what do psychedelics do to our psyche? And we just focus so much of the above the neck. And it takes that kind of shift and just a little bit of leap of faith sometimes to be like, no, the body will tell you in mysterious ways. It's just never fails to amaze me as I'll be like, oh no, I'm feeling this little thing here. And then somehow like some big release comes from whatever, happens when we go in and ask that thing more about itself. So do you mind describing a little bit about, we mentioned in your bio, somatic experiencing?
Yeah, I would love to. And what comes to me is like, I study Chinese medicine and that's what I practice primarily. And this is part of an extension of that. And we talk about yin and yang in Chinese medicine, right? And so that's separated into many different iterations of what that means. But the brain we can think of as really yang, and the body we can think of as really yin. And we live in a really yang culture. And so it's like, of course, our brain, it's so cute. It wants to take over every conversation. It feels like it knows what's best. It knows what to do. And it is really vulnerable. And it is a really big leap of faith to say, hey, we're actually going to let this like softer, more yin part have a voice. And you do kind of have to, with a lot of love, just tell the brain like, I love you. We're going to parking lot your thoughts for a while. You're so sweet, but like, shh, right now it's the body's turn. Sometimes I'll make the analogy of like, if you're at a board meeting and one person is talking, like just taking the floor all the time, you kind of have to check them lovingly a little bit to get the rest of the board members' feedback. So you can think about it a little bit that way. So I'll walk into a little bit about how I run sessions. And obviously there's so many different ways, and everyone should find a practitioner that they trust and like, who has a modality that they like the most. So by no means is this meant to be like the way, because there's so many ways. But what I'll typically do with clients who are interested in this work is we'll do a little bit of talking first, because sometimes the brain just has to offload the words, and those are always important. And we want to honor that part. That usually has to happen first because our brains are just so used to taking the floor and being prioritized. So we'll do that for a while. And then we'll go, if it feels right, we'll go inward. And what I mean by that is it's just a little bit of a guided kind of out of this outward sensing state where we're like looking at stuff and talking a bunch and go. And we'll just kind of on purpose walk the body inward. And that sounds kind of like vague, but it's like we'll notice more external sensing things like sight and sound, and then we'll go more internal to this deeper space of the body. And a lot of people need to learn how to do that. They really are like, I feel nothing. Nothing's coming up. And then we look at the nothingness. Like it's really, I think the biggest message, and you touched on this before, is like you cannot do it wrong. It's kind of like meditation. Like people are like, I can't meditate. I don't know how. I suck at meditation. You're like, you can't do it wrong. The only way to not do it right is to not do it at all. And even then you're probably meditating and you don't even know it. So somatic experiencing is kind of the same way, but the element here that is missing in a lot of other experiences is the safe witnessing by someone else. So when we're going into the body, it can feel really vulnerable. And so there's another person, which obviously in this case would be me, who's watching. So I'm watching for signs of the body shifting in some ways that I can then reflect back as noticing, which again is really vulnerable, because a lot of times as humans, we're animals and we want to hide vulnerability. So when we're talking with someone, we'll like on purpose make different facial expressions, or we'll try to look really relaxed when we're freaking out inside. And so it can feel really vulnerable to have someone who's trained to witness that, watching, to see like, hey, I noticed your breathing shift. And inside it can be like, oh shit, like shit. I don't know if I cussed. Sorry if I cussed out of line, but anyway.
You can.
All right. We can have all sorts of different feelings that come up that feel like, oh no, I'm being noticed. And it's in a way that I don't feel in control of. Whereas with like talk therapy, for example, we can choose our words, we can frame it however we want. We're so skilled at hiding. And so somatic experiencing, or Hakomi, any of these worlds, is trained to hone into some of these subtle nuances and then create some safety. So ideally, if someone's like, hey, I'm noticing I actually want to hide this. So a lot of people, for example, will want to hold in tears. But if someone is trained to witness that like tightening of the throat, they can then say that in the space. And a lot of times it's like, she noticed, and so the work is then in that practitioner client relationship of, I'm noticing because that's for the best benefit of this, not to catch you, So, and then during the inner work, like you touched on this already, is some of it's really small. It's like my shoulder itches, and you're like, okay, let's investigate. Does that itch symbolize something that wants to be a kind of unraveled a little bit more, or is it just physiology doing physiology? And so we start to learn how to figure out what is the body being like shiny object, distract because you're getting close to something I'm nervous about, and what is the body being like, hey, this is a really important thing to look at, and what is the balance there? So it's, my primary driver is nonviolence. So if something feels too deep, too soon, we don't need to go there. It's not a like, I'm going to like rip into your soul, carve out everything I can and bring it up to surface. It's like, this is an unfolding. And in the same way, you can't force, a rosebud to open by prying it open. We don't do that with people. And we don't do that when we're in those deeper states of body either. So it's like, in a way, the somatic practitioner is kind of a bodyguard. In the same way, when you're in psychedelic experiences, ideally you have a trained facilitator that's holding space. So that if the client starts to get flooded or overwhelmed, they have someone there to help guide them back out, just be there with them. It's like almost like what a doula would do during childbirth, that kind of role. So then we see what the body has to offer, always respectfully. So, the part of the brain that wants to work really hard, we honor that. It's never like kill the ego death. It's never that. It's like, yeah, this is working to serve us. Like, I think sometimes we get this framework of like, we're bad in some way, or there's parts of us we need to get rid of in some way. And that's where people bump into a lot of conflict in psychedelics as well. They'll get scared of themselves. And that can happen without psychedelic medicine, just in this deeper space. And so a lot of the work is making sure people learn they don't have to feel afraid of themselves. No part of you is like coming to get you. I'm doing air quotes. I know people can't see me, but no part of you is trying to like trick you or hurt you or surprise you. And so it's kind of, sometimes I'll describe it as like I'm helping people guide themselves back to themselves and find a safe home there again, because through unhelpful messaging, we've been taught we are not our own safe homes. And that's super sad to me. So anyway, that's kind of how the work goes. And then once that feels complete, if the time container's up, if the moment feels complete, then we'll do just a brief guiding outward, back into the outer sensing body, just so the person feels kind of back in the space. And then we'll close out kind of however seems the best for that moment. That can mean more talking with words. That can mean letting the person continue resting for a little bit. It's kind of that type of moment. And then I'll usually take a few notes so that the person doesn't have their brain trying to be like, oh, I want to remember that. So their brain can really just take that breather and respite that it rarely gets. So I'll take a few notes in my practice and send it to, not like meeting minutes, but just a few little like, hey, reminder stuff. And so that's kind of like a walkthrough of a session.
I love that. And I wanted to touch on something you brought up, because I had said in the intro, like, okay, these psychedelic adjuncts are good for maybe preparation, integration. What I definitely left out, now that I think about it, is that, and one of my big things, do you like how no sentence was finished there? As I'm self-editing. Poor show notes. Mind Jared, I love you. The thing is, I'm a big advocate of there being a psychedelic type option for everyone, including those who cannot medically take a psychedelic medicine with a hallucination, right? And it occurs to me that I mean, I have undergone somatic experiences that felt like psychedelic journeys. And yet I don't think my heart rate was abnormally high or any of the things that generally make psychedelics medically contraindicated. And often they're also, psychiatrically contraindicated for some people. It, I guess I have a question. Is there anybody for whom somatic experiencing is contraindicated?
That's a great question. And I think no, if it's dosed well with a skilled practitioner. So people are at different levels of being able to be with themselves. And again, if that's done to, it's kind of like the dose makes the poison. So if there's someone who is really, really shy and tentative about meeting themselves deeply, then we want to help dose that well. It's not like just walk in and say hi. Like people can be
Yeah.
introverted with themselves because we are our own relationship with ourselves, which is kind of an odd way to think about it for people who haven't thought about it that way before. But sometimes I'll kind of joke like I feel like I'm a marriage and family counselor for couples, but it's just you and you. And the reason I would make a terrible therapist, like licensed therapist, is because I always take the side of the body. Like I'm just like I am just on the side of the body just so blatantly. Um, but it really is like you and you. So if there's so much conflict, so much trauma, um, we all have different levels of dissociation that has been a skillful strategy at various times in our life. So if the practitioner hasn't done a lot of their own work, meaning like what are their triggers, how are they navigating deep grief, deep fear, deep shame, deep all of these things, then you, in the same way for psychedelics, you don't want to be in a really vulnerable state with someone who can't hold that space. And so I guess the contraindication would just mostly be don't find a bad practitioner. But as far as like,
Here, here.
yeah, like as far as people go, I can't think of anything because people can go as slowly as they want. And it's a level of trust building. Like a lot of people need to fall back in love with themselves and have new levels of trust unfold. And so I would say for people who have a really strong scarcity mindset, like I have to do this all in one session, they kind of need someone who can help them understand that's not always the kindest thing for themselves. It's like people who go, I have a version of this where versions of me in the past have like been like, I'm all in, go hard, go home, and I would approach emotional work that way as well. And it's not helpful in any realm. I mean, it's adorable, but it is not helpful. And so we need people to help pull us back. And often that characteristic and that quality is approaching a very yin moment from a very yang perspective, like the hurry up and relax stuff. And this realm, I include psychedelics and the psychedelic adjunct as well with it, it's a lot of do less. It's a lot of do nothing. And in the nothing is where the benefit is. And that's hard for our Western mindset of go, go, go. We think of like squeezing every minute and dollar out. And if we're not like crying and sobbing and shaking and vomiting, it wasn't worth it because it wasn't, I don't know, too aggressive enough. And to me, that's really sad because there's this whole world that we're missing of like the kind of missing chi experience of softness and unfolding. And that is it to me, it's much more potent and powerful and longer lasting. So like I'll say sometimes when I'm doing body work on someone, I can force your muscles into submission, but that's not the goal. The goal is to give them an opportunity to relax and have them choose to relax because the power is in the choice. So for somatic work as well, the power is in the choice, the person making the choice to go in. And in a way, I find that more potent even than psychedelics because psychedelics aren't going to let you choose not to. Like when you're in, I mean, to a point, right?
Right.
You're in, you're like, whoop, I drank that last cup. Here we go. Or whatever it is, right? So, and a lot of people need that because they need that like push over the edge. But with somatic work, no one's pushing you over the edge. It is you choosing to go as deep as you want. And that to me is like, it's just really gorgeous. And we can do powerful work through that person holding autonomy. So again, I know your question was about contraindications. And while I'm saying no, I'm just, people who are listening to this can think about where they stand in this stuff. So, where are they in terms of receiving and choice and softness and approaching themselves deeply and honestly, not just from a brain perspective, but from a body perspective. And And then they can decide if it feels good for them. Because some people are going to be like, ugh, that sounds awful. And that's something to look at for them. Like maybe they could, check and see if it really is.
Yeah, I have to admit I was probably one of those people because, as you said, right, like some of us don't feel the body is the safest place. And I am, pretty upfront about my anxiety is health-based. Like the last thing I wake up and I'm like, what hurts today? What is itching? What is giving me a sip? Medical school did this to me, right? It turns you into a not everybody, but it can turn you into a hypochondriac because ignorance is bliss. And the opposite of that is the more you know, the more diseases you could have in any given day, right? And so like the thought of like, okay, now we're going to go inward and scan your body. I was like, oh, please no. Like, can we do therapy to get me less afraid of scanning my body first? But yes, I very much appreciate that you have set it up that way. Just on the contraindication front, what about something like somebody who struggles with schizophrenia, where, because, in the somatic experiencing, very often we're kind of like talking and asking questions to a body part or, some vision that we're seeing in our mind's eye when we go into the body. What about in cases where somebody may have something like schizophrenia or psychosis where that's kind of a separate issue for them as well?
So I have so much respect for people who have diagnoses of schizophrenia and multiple personality disorders and whatever the latest DSM version description is. And I hope that they're working with a really, really awesome psychiatrist and therapist already. And I would hope that if I came on as a practitioner for them, that would be a team approach where we decide together what feels right. What would really give me pause is to say, because you have a relationship with schizophrenia, and these potentially voices or hallucinations, I would hate to say that means you can't dive deeper into your own body. That feels really sad and really unhelpful. And so it would be a conversation with that person. Like, are they taking medications? What are their goals? Do they even want to do this work? Like, I think for me, what I would be really interested in, I would not say no to working with them. I would say, here are some things that make me curious that I would love to know more about you. And we would probably take it even slower. And I would ideally be talking and in communication, of course, with the client's permission, to their other care team, because a lot of times it is like parts work, right? Even in like internal family systems and all these new-ish modalities that are coming out, like sometimes at times, like I'll feel like, oh my God, do I have schizophrenia? Like, which I don't. I'm just learning
Right.
parts of myself and personifying parts of myself and giving voice to parts of myself. And I mean, in the same way, sometimes I'll read stuff on Instagram that's like, you have ADHD if, and I'm like, do I have ADHD? Because I'm like, I also do that. Like, I have a lot of tabs open on my computer. So I think we're really into diagnosing ourselves because it feels helpful or something. We feel control. I don't know. But I would say that would be a case by case basis. And for me, better or worse, like I so trust bodies. I so trust them to guide us to where we need to go. And I think that we think we have less capacity for that than we actually do. And we've learned, especially in this iteration of our society, where we're like, instant gratification, like I can get an Amazon delivery like now if I want. Like it's like they just arrive faster and faster. But and scrolling and all this like really immediate gratification, we have lost our relationship with discomfort. And a lot of this work is uncomfortable, and the work is being in the discomfort and building a larger capacity for being uncomfortable and learning the difference between uncomfortable and unhelpful, because that's not something that we're trained in. So if someone had, a bipolar or any of these kind of bigger diagnoses that are often contraindicated in psychedelic trips, I would be really excited to work with them to see where we could go. But it may look different than a standard. Standard. I mean, everyone is different. Yeah. Even the same person coming back with whatever cadence is different at that moment. So we're always relearning each other. But yeah, I cannot think of a reason that would be unhelpful, if that person felt motivation to do it. And again, we would figure out the dosage, and we would have a lot of respect for the rest of the care team that's there.
I love that so much. I just want to stop and appreciate that answer for anybody listening who has, and a lot of people have come to me specifically. I'm glad you added that at the end, who are struggling with bipolar disorder. And what was a contraindication a year ago is now in question, right? Then they did a study on, I think, psilocybin for patients with bipolar disorder, and it actually was found to be helpful and not, like you said, harmful or unhelpful. And so what is a contraindication is, one, always changing, but two, I love that you pointed out something that I want every listener to know is that if your practitioner, psychedelic or otherwise, is not supportive of you working with your other practitioners, that is a red flag and a
Yeah.
very much a green flag. If they say, I would love to be part of your care team, let's work together. I think there's kind of a lot of hubris, and especially the psychedelic realm, where like ignore all of Western medicine, we've got the answer. And that has ended up for many people in some dangerous situations. And so thank you for shedding a light to the fact that this, in a number of situations, this should be a collaborative effort.
It should be. And I also like, I want to highlight for people, it doesn't have to be tedious and painful and boring. It can be really fun. Like these sessions are just as important for integrating joy and bliss and pleasure. And I think we think of like psychedelic work and psychedelic adjacent work as needing to be hard and painful to be helpful. And I think that's a false narrative. So there will be times when it's hard and painful and excruciating. And there will be times when it's like the practice is in experiencing, receiving joy, because we're not that good at that as a culture. Like we don't really stop and pause. Like we have a good thing happen and we're like, I don't want to jinx it. So we don't even tell people, much less share it, and that is so sad to me. So I'm like, one of the things I'll say is like, we can do hard work, but it doesn't have to be hard. Like we can be laughing. It can be silly. The body is silly. It is silly. Our brains are wacky. Psychedelic trips will show you that. You're like, what is happening with that thing? But our bodies do it too. They want to please us and they want to be seen and they want to be witnessed, but they want to have fun at their core. Like we're very childlike in our nature of playfulness. So, for people who are like, oh man, I have schizophrenia and bipolar and all this trauma, it's like, yeah, maybe the work is in, like today, I posted a cute picture of a blueberry on, I'm sober, right? I'm like not on anything. I'm just like, oh my God, this blueberry is so cute. Like, because I have worked with myself so much to notice those little things. And I think what I find was some people are drawn to psychedelics or, marijuana or whatever, because they want an excuse to feel playful. Like people will sometimes use alcohol as an excuse to do things they want to do anyway, like hit on someone or be flirtatious or engage in behaviors that they wanted to do anyway, but they needed like the liquid courage. I'm doing more air quotes. I guess I'll just have to say that. But like psychedelics feel like an excuse either to be a little bit masochistic because we have this like we're bad and we should be punished thing that can be worked on, or as an excuse to be playful and silly when we can actually just do those things without them if we wanted to. I'm not saying don't engage with them at all, but I think sometimes like somatic work, like it can be really, really fun and really silly. And those sessions are just as healing, if not more sometimes, than the ones where there's lots of tears. So make sure, like you use the word hubris, which I love because there are a lot of people, practitioners and clients who just take themselves so seriously. Like, and while yes, it's serious work, also the universe is just like a damn goofball. And we should also learn from that. So anyway, I just want to highlight that because it can sound really like, oh, we got to do this big work. We got to go in and feel more pain, pain on pain, or it's no gain, right? That kind of whatever. And it doesn't always have to be like that. Like lots of laughter, lots of fun, lots of happiness. We need to balance it out with that as well.
Yeah, absolutely. And I even wanted to harken back to something you said before. One of my least favorite phrases is heroic dose, because that suggests that unless you are straight up punching your psyche in the noggin with 5 grams of mushrooms, you're not a hero. To me, the heroes are the ones who know that, like you said, the softer work is sometimes the work that we need to be doing, the more playful work, the either a smaller dose or the non-psychedelic thing, right? Like that, to me, it is, there's nothing heroic about just smashing something with, and by the way, sometimes very dangerously. I mean, I know people that have had very, very, let's say, some let's say not asked for outcomes on their heroic dose, because maybe they did it with zero practitioner, as many times as I said, please don't do that. Like, there's nothing heroic about that. I'm not going to buy a comic book with you on the cover because you have done this. This is absolutely it's a name that I have tried to phase out. In nothing that I put on the web anywhere have I left in the phrase heroic dose, despite being asked to, because I think there are, like you said, the dose makes the poison and makes the anecdote, right? Like, this is only going to be helpful for you if you take it in the proper dose. And we don't want that dose to make the poison. And we'd like to have it in the, if so many times people can be traumatized through having done too high a dose. And then are you going to be less likely to do the dose that's good for you later? You might be, because you've been traumatized by entirely too, like you said, too harsh a dose of psychedelics, or too harsh a going inward in somatic experiencing, any of those things, right? And so I really appreciate that you brought to light that there's definitely a place for an under championed place for doing less.
Oh my God, it's so important to do less. I love that not asked for outcome. I really feel so strongly about this. And I also have been the version that would have been like, give me more. Like, I have been that. And I work with not being that actively, because I have a competitive nature and I grew up in this culture, and I like to feel strong, and I like to feel like I can endure anything. Like, I like that kind of sense of like, energy of like, yeah, I can handle whatever. And what I had to realize, and what I hope people realize, is we as humans have an endless capacity to endure. And the work is in not forcing ourselves to, because we think like, when we're approaching anything from the somatic work to any modality, if we come from the approach of we're broken and we're missing something and we're bad, then we're always going to be hunting around for that, to find it, eradicate it, fix it, fill it. And in reality, we're all whole. And so we're hunting for things that don't exist. We don't have brokenness. We don't have emptiness. We don't have any of that. We're whole beings. And so when we're looking for the missing bad parts and we don't find them, we think, I have to look harder. I have to look better. I have to look more. I have to look more aggressively. And we do that in higher and higher doses of psychedelics, or more and more and more psychedelics, or the more brutal ones, or somatic experiencing work where it's like, no, I want to go in and I just want you to like rip my body apart. Like, we're so weird with ourselves because we're misinformed. We're like, if the military is sent in to a city and they said, find the enemy and find what's wrong here, and there's no enemy and there's nothing wrong there, they're going to be hunting all over the place. And they're going to get more and more and more nervous because they're like, oh, well, we better find the enemy. We can't find. And we do that to ourselves internally. And it's so sad to me. Like, I'm tearing up right now, even thinking about it, because it's just so awful. And if we keep looking for the things that are bad about us, we will keep doing crueler and crueler things to ourselves in that false effort. But that mission was flawed to begin with. And so if people can pause for a second and they can say, I can endure endless amounts of things. We know that. You could take so many mushrooms. I mean, obviously up to a point of death, right? But anyone can endure anything. We can do that. We're so powerful as humans. And the work is to not. The work is to be so loving and kind to ourselves that we say, enough is enough. But we chase healing like it's some kind of competition. And it's not a competition. So yeah, I'm with you on that. Like, the whole hero's dose thing, it's like, it's cooler to me if someone's like, no, I'm just going to like lay in this field and look at the clouds and not do that. I'm like, that's actually the hero dose. Like, I don't know what we're doing out here these days. And I won't, I do acupuncture and body work as well. And I have people who like, they want like the hardest dry needling and they want the most cupping and they want to, the deepest tissue work. And I'm like, ooh, these are the people that need the softest, right? So I'll refer them out to another practitioner because I side with the body every time. And so I'm not the right person to fulfill your kind of masochistic cruelty on your body because you think you have to whip it into control because it's bad or flawed or broken or whatever. So anyway, I'm getting on a little bit of a soapbox about it because I'm so passionate about it. But yeah, I mean, I think we need to approach things differently. The way that we're approaching it right now, I don't see as helpful. I don't mean that in terms of psychedelics, but even it's so Western and American of us to be like, we need more. It's like, think of we're using plants and mushrooms and substances, and we're using them kind of irreverently sometimes. Like you can say no and do less, and it's just as powerful, if not more. And with somatic work, a lot of it is kind of bodyguarding people from themselves if they want to go in too hard, too fast. And again, it's tricky because it's not that I want clients to think like, oh, she just wants me to book more sessions. Like, you don't have to at all. Like, I am not in this to buy a yacht. Like, so it's hard. It's in our society where we're like, everyone's capitalistic and everyone's here to like get more money and da da da. Like, it's hard when someone says, hey, I think we need to go slower, because we hear that as, oh, you're just greedy and you want more. And that's tricky. Or like, yeah. So I think I've said enough about that.
I like your soapbox. I have to say, and just for anybody, like to dovetail from what you mentioned, is that in the being kind realm, there are times when I've shown up for somatic therapy already in a very agitated state. Things are very rough. And the week before I'd said, okay, next week we're going to do a little deep dive into this thing. And I'd planned to do a deep dive. And my practitioner will say like, today's not the day for that. You know, let's be kinder to your body. Let's do something else that's more gentle. And I love that. And so that's, again, you know, a skilled practitioner knowing what is helpful versus harmful. And I think that's what one of the things I like most about it is that I don't have to be scared. Like when I finally did get to the point where I was like, yes, let's do the deep dive. I'm ready for it. Like I felt ready. I felt like it was necessary. It was not like anything out of like the masochistic side, as you mentioned. And I wanted to ask you about this. This is total non sequitur, but it's a thing I always see on the gram. Speaking of things you see on Instagram, people are always doing shadow work. Can you tell me what that is? I sound very naive. I mean, I live in Hippielandia, Southern California, and I hear it, but it sounds to me like kind of what you were describing. The reason I thought of it is like describing going around, like you said in the military, like they're looking for the shadows, they're digging. Do you know what they're referring to? Can you elaborate on that?
Yeah. Shadow work. Yeah. I kind of lump that in a little bit with like ego death, you know, and I don't actually agree with either. I love my shadow, and I love my ego. And what I think, so to explain it, is when people say shadow work, they typically mean the parts of ourselves that we try to hide from others and from ourselves. So usually that shows up in terms of shame or manipulative tactics or lying, or just kind of the unconscious, subconscious ways that we operate that may be not helpful. So that can be anywhere from trauma that we've never disclosed, to things we've done that we're not proud of, if not ashamed of, to like having qualities like jealousy or envy in a world where, you know, we're not supposed to have those. I'm doing my air quotes again. And or you know, for women having anger, like a strong angry side, or for men having a strong sad sensitive side, like the kind of polarities of emotion that we do with genders. It's kind of all that. It's all the stuff that you want to tuck under a rug and not look at. So that's kind of what most people mean when they say shadow work, is bringing that up and out. Some people want to talk about getting rid of it, like shadow work to get rid of it. I like when people talk about it in terms of integrating it. So to me, if it's shadow work, meaning, I'll share an anecdote from myself because I have made so many mistakes and I hope people can learn from them. One was that when I started to approach shadow work, I was approaching it like I was hunting down things. Like imagine like I'm hunting like rabbits or something, and I was trying to find them and eradicate, coax them out and kill them. But what I was saying to myself was like, no, you're fine. Come on out. Come out. I just want to integrate you. Come out. But I knew I was going to kill it the minute it came out, right? So what did my very clever shadow bits do? They hid better. So smart. And I realized, like, what am I doing? Like, all those shadow bits have served me so well in some way. And here I am trying to like trickster them to come out when it's me. I know my own self. I know what I'm doing. Like, I'm not going to hurt you. Come on. You know, wham. Like, I know I'm going to do that again to myself. And so I was in this weird little dance. And then finally I just became really committed to being like, hold up. I am just going to unapologetically love all of this. And really, truly, if any of my shadow bits are brave enough to give me another try, I will do better this time. And not only will I not kill you after I coax you out, I will embrace you and love you and throw you a party and give you a primary seat at the table and ask you all the questions that I've been ignoring and wrap you in my arms. And that's what I've been doing ever since. And so now my shadow is so available to me, shadows, I should say, because I have lots of them. They're so available to me. They're just part of me now. And it's the same with ego. It's like, my ego is rad. It's what gave me the audacity to start a business and the audacity to go back to school when I was a single mom and the audacity to think I can be anyone in this world. My ego is fantastic. Why would I kill it? So the goal is not to then say I'm all ego and all shadow. It's to say these are really awesome parts of me that have served me in some ways, maybe no longer serve me now. So let's find a new role for them. But it's not to eradicate and kill. And I think a lot of people are out here doing a version of what I had done, which is saying, we want to do some shadow work. And then as soon as anything is tender and sweet and courageous enough to be like, I'll be worked on, we beat it up. It's like, well, yeah, that's going to be a hard dynamic. So again, psychedelics will sometimes pull your shadows out. But somatic work is kind of like, okay, hold on, let's start over, new approach. That was not the right approach. Let me try again, and doing that on purpose. And that to me is really awesome. And I think, does that answer your question about like shadow work?
Absolutely.
Yeah. Okay.
Yes. I mean, because I basically thought, like, when you started talking, I was like, well, what I always, you were basically describing kind of what I assumed it was, but I also just assumed that was going to therapy, right? Like, I just, I thought that's like a lot of the things we discuss in therapy are oh, I'm feeling this jealousy about this thing, or I'm feeling anger toward this person. I'm like, I didn't know there was maybe they just gave it a hippie term, but I do appreciate that through that hippie term, you led us through that discussion about what you had thought and how you went about it, because I think so many people are going to benefit from that. It was such a beautiful description. Jenna knows I don't like metaphors, and I was so into that one. So
I feel like I won.
You won, Jenna. I'm with the rabbits. I'm following along. But seriously, because I think you said, so many people are like, they want to punish themselves, and that is, if you're punishing, you can't ask that the shame, why are you here, or the jealousy, what can I learn from you? Like the goal isn't to just like whack-a-mole eradicate the thing. And it just, I mean, if you're a believer in psychedelics, poor anybody listening to my lack of sentences, there's no periods in my rants at this point. But if you're into psychedelics, it's generally because you want to get to the core instead of just taking, perhaps a medicine to try to chase the symptoms every day. Well, if you've whacked at your shadow, they're not going to reveal the core, and you're just going to have to keep whacking at the shadows all the time, it seems like. And so I really appreciate that you even shared your own story with that. I have to say, one of the most powerful things that I got through somatic experiencing was because I was going through therapist after therapist, about 10 years ago. And I remember, like, I would get a new therapist, and the first thing I would say is, if you just plan to tell me to love myself, this isn't going to go anywhere. I was like, because I haven't figured out how. Can't figure that out, right? Like, there's no guidebook on love yourself, right? Somatic experiencing showed me how. And literally there was, one day where it was just like, okay, now go find all the parts of you that you don't love and give them a hug. And like, I wasn't told to do that. Or maybe there was like a small suggestion, but I just started finding more parts and more parts and more parts, and like embracing them, because it's really hard to love yourself when you're hating and punishing some part of yourself. It's kind of your brain's smart, but it's, it can't dissociate that much to be like, oh, I love part of you. Like, you got to love the whole thing or not, right? Warts and all, as they say. So thank you for explaining that. I really appreciate it. Lastly, I would love to cover just a little bit more specifically. We talked about, what somatic therapy and somatic experiencing are. Can you talk a little bit about how and when you would suggest people use them in preparation or integration? Maybe one, we could talk about, how they'd be beneficial, and maybe at what point of, obviously everybody's different, but at what points of those different, journeys do you think that they may be helpful to work those in?
Yeah, I mean, I think it's going to obviously depend on the person and what psychedelic they may be interested in. So, and like how that's going to be structured. So if it's like a retreat for a week, they may actually have some of this stuff as part of it. If it's like an afternoon that they're going to have with someone, it may be different. But I would say for someone who's never done self-work, like no therapy or, no meditation, none of that, I would start as soon as possible. So if someone has not done psychedelics and they're curious, I would start engaging with some of these adjacent things as early as possible. But if someone's already kind of done the psychedelic world, they're interested in adding on something here or there, it might be nice to have like about a week before they're going to have a psychedelic experience, have a check-in with the practitioner. Maybe it can be some deeper, the body tells us so much. So there may be like some intentions that the brain didn't even know that the body would like to see if they can incorporate during the psychedelic experience. So about a week before is usually pretty nice, and about a week after, unless it's anticipated to be really major for the person, then usually maybe within the 72 hours afterward. But depending on the medicine, sometimes it's in the body for a while after. So somatic experiencing is shifted, or getting into the body is shifted by that. So kind of a week on either end would be an awesome structure. But again, there's no way to do it wrong. And if you don't do it at all, that's totally fine. If you do it a month before or a day before, there's no wrong way to do it. There's just kind of what I've seen to be kind of the most helpful for the most people.
Do people ever come after having an experience and say like, this is what came to me in the journey? And does, like you said, generally there's talking at the beginning of the sessions, say they bring that up at the beginning of the session. Does that, I know you said, you go into the wisdom of the body. Is there ever like an interaction between what they came out of the journey with and then what shows up in their experiencing session?
Sometimes bodies don't care. Like we'll think it's like this profound thing in our brain, and the body's like, yeah, that's all right. Like, just get over that. Like it just, so sometimes it's like, we're like, oh my gosh, I had the most amazing revelation. And we expect the body to be like, that was amazing. And the body's just kind of like, yeah. We've been telling you that for decades. You're lovable. But our brain's like, we're what? So sometimes it aligns, sometimes it doesn't. But there's always something interesting that comes out of it. Even if there's, some people will have a big experience and then they'll feel kind of numb after, which is also interesting. There's like a numbness that shows up, like almost like a vulnerability hangover. And so we work with that of like, ooh, okay, sometimes maybe the body withdraws after a big experience. Like, we didn't know that, so there's learning that can happen in everything. And I think the expectation is kind of have no expectation. Like we can have a loose intention and then we let the body lead. And again, the body's right. So whatever our brain thinks it wants to do, we're just like, maybe, and then we see what the body is actually wanting to do.
Got it. And one last thing, because I know people are going to ask, and I think I know what the answer would be, but I'm just going to ask. People will probably wonder, well, this is a form of therapy. Is this something that could be done with psychedelics? Like, because at this point, we did an episode on psychedelics and EMDR, and but most psychedelic assisted therapy is just non-directive. And so people are wondering, well, what types of therapy will work with psychedelics? Do you think somatic therapy is one that there's a place for a psychedelic in there, or you think they're best to be kept separate?
I think they could absolutely be joined together. But again, I don't want to get all biohacky about it. You know how people are like self-care, what do they call it? Stacking or something? I don't know. It's like,
yes.
It's like, I don't know, like, are you going to have a face mask on while you do it too? Like, let's just let ourselves be for a little bit. So maybe, like, and I think it depends. But like, I don't want like some center that all of a sudden is like, we do psychedelics and somatic experiencing and Hakomi, and you get a pedicure at the same time while getting a massage, while your red light's on and your aura ring reading is like, I'm like, oh my God, I can just do that. Like, I'm like,
can you tell Jenna lives in Austin?
I'm just so tired of it. I am not, but love a good red light. I'm not gonna lie, but anyway, I do think the two can go together. I do still not, I want to give each its due, right? So I think, like a loose guiding would be helpful, but again, like I wouldn't want to be in a position where I felt I was like bossing the medicine around. If someone's on a mushroom journey, I am not gonna get in between the mushrooms and the body. I'm gonna be like, y'all do your thing. It's kind of like if too many practitioners or too many cooks in the kitchen, like I would be like, well, I'm deferring to the medicine. Like this is ancient medicine. Who am I talk about hubris to be like, I'm going to
Right.
tell ayahuasca what she should do with you. Like, I just cannot, personally, I cannot imagine being that person.
Right.
However, I could imagine a version of sitting deeply witnessing someone while they're in a psychedelic experience. And if they had a moment of discomfort, confusion, etc., I can imagine being there to help um, direct them back to themselves or direct them back to the medicine. And that's what trained psychedelic facilitators do anyway. So I think a lot of this stuff we call different things, but it's actually, when you look at it, you're like, wait, in a Venn diagram, they all overlap a ton. So whether it's, psychedelic facilitator or somatic experiencing or Hakomi, or there's a million terms for it. We all, I think, have a similar goal, which is to help people find their way to themselves and love themselves and live a more enriched, full life. And I think that can be done, with the medicine. But again, if I would have curiosity, I guess, for any person who thought that they could direct psychedelics.
Right, right. Well, and so I'm glad, because my guess was going to be no, and the reason was because, and I wasn't thinking about psilocybin or ayahuasca. I was thinking more of the things that we give traditionally in psycholytic doses, which is more like a low dose ketamine or even a cannabis, which is just generally to open up a little bit and to facilitate some, I guess, connection between the practitioner. But even at that, I thought, like, the fact that so many of the somatic things are telling the brain, this is not your time to talk, and psychedelics are lighting up the brain, like, let's do all the brain things. I thought maybe it would actually be kind of disruptive to the somatic process, perhaps. That was
Yeah,
my
I mean,
guess.
I think people have different experiences, as we know, on psychedelics. And so this is like so woo woo of me to say, but like kind of whatever happens will be the right thing to happen. So if someone wants to do, I'm sure, I mean, probably a lot of my clients are microdosing while I'm talking to them, and I don't even know. I mean, I would hope they tell me, but
With
it's
a
all
face
going to
mask
be
and a
fine.
red light.
Yeah, yeah. It's all going to be okay. Um, and if someone does get really chatty during a psychedelic experience, it may be because they're really nervous, and they'll start to talk because they want to distract themselves from their body. And so, having someone there to help them know, like, hey, like a doula would be, right, in childbirth, like helping them know that they're safe and it's fine. Yeah, and a lot of these, the research on things like ibogaine for coming off heroin, or MDMA for severe depression, some of the newer emerging research does have some of the talk therapy alongside it, and I think that that's awesome. So again, like, I wouldn't see it as problematic on the surface. I would just see it as like, are we trying to do too much too fast with one moment, when like our unfolding will take whatever time it does. At a certain point, we get to just decide that we're good. And like, there's no end point to healing, right? It's just kind of like, you can't like ever drink enough water to never have to drink enough water again. It's just kind of always, and that's not even just healing. It's just kind of like being with ourselves. Like, if you're in a relationship and y'all stop trying and get complacent, that relationship will falter, right? So if our relationship with ourselves becomes complacent, and we stop trying to get to know and learn ourselves, we will falter. And so, but again, like, I don't know that we need to do all the things all at once. But again, I mean, if that calls to somebody, then rock on, good for them. I probably wouldn't be the right practitioner for that, because I have too much respect for a lot of these medicines.
Yeah, absolutely. I think if there is one overarching theme, it's the wisdom of Paul Rudd in the Forgetting Sarah Marshall movie, where he's teaching surfing. I don't know if you recall this, because somebody had to point this out to me, because they just kept telling me, do less. And I had to go watch the movie, and that's what he just kept saying. That was his entire like surf teaching, was like, just do less, man, do less. But I very much appreciate that. And I love the end game there, where you were like, all this stacking of all the things. Like, I have had to be told in my own therapy training, when I was like, can you fix me? I'm ready to be fixed. And the answer was, do less, do fewer things to fix yourself. And then your nervous system will chill out because your nervous system is very amped up from all the things you're doing to try to fix yourself. Says
I,
girl wearing Aura Ring for almost 7 years.
I told one of my clients recently, I was like, man, you are wellnessing your way into illness. Like you're doing too much. And so I just, yeah, like we need to stop going so hard at our own healing. And we just need to like recognize like nothing is wrong with us. We're so awesome. And we can just optimize that in like sweet, subtle, awesome ways. I said awesome a million times there and I mean it, every word. um, but this is just again, it's like a coming home to yourself. We're so sweet to think that we were anything but whole from the beginning. And, if we keep trying to like, I don't know, if the hypothesis is that we're bad and not whole and broken, it's a faulty hypothesis and you're going to keep having failed experiments. And so I would encourage people to start hypothesizing that they're whole and running experiments off that. And I think you'll have a lot more luck.
Words to end by from Jenna Valentine. I love that so much. That was beautiful. Show note exclamation point. Jenna, this has been one of my favorite conversations ever. I adore you and the work you do and the wisdom you bring. Can you please tell people where to find more about you?
I have so enjoyed this. I'm so honored to be on your podcast and you're such a gifted podcaster. So thank you. Thank you. I can be found, Instagram is Valentine Care Wellness and my website is valentinecare.com. And then y'all can text is usually my fastest response time, or you can DM me on Instagram, but those are the main ways. My clinic is in Austin, Texas. And so people want to see in person, they can do that. Or I have a lot of clients via Zoom for somatic coaching work. So that's also available for people if they want that. And I would love to hear people's feedback, comments, questions. If I misspoke, I want to hear about that too. Be nice to me though. Like, I feel things. And, if you want to
I'm very good at,
I'll take it.
I'm very good at patrolling the trolls. There is no hate on my gram.
I believe it. Yeah.
Jenna, thank you so much again for coming and sharing with us today.
Thank you.
For everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.